Hello. Today on Community Connections, we have two representatives from Beacon of Life, a new program over at the Old Fort Monmouth. Today I have with me Noel Peters and Sue Skola from Beacon of Life, which is a medical program over at Fort Monmouth, the old Patterson Army Hospital. Thank you for coming over.
No, thank you for having us.
Now, we were talking before, this is a PACE program. That stands for?
A program of all-inclusive care for the elderly.
And that means what?
Basically, it means what it says, that this is a comprehensive program that is all-inclusive for individuals that are frail, elders, that can safely live in the community with the help of and support of the services that we provide in the PACE program.
When you say frail, that means exactly what to you? Or, you know, what kind of patient or participant are you looking for?
This is an individual that could potentially be in a nursing home. They can be 55 and older, but have, you know, multiple medical conditions, need assistance with basic activities of daily living, and you know, could qualify to be in a nursing home. But the whole idea of having this, the PACE program is to try to keep them living at home and keep them community-based for as long as possible in a safe environment.
So I take it it's got two goals, one of which is to manage their health care, and two, it's to keep them out of a nursing home, keep them in society. It's which I assume is a higher standard and a better standard of living for them.
Well, most of these individuals don't want to be in a nursing home.
Mm-hmm.
Many of them are either alone or being taken care of by their children or other caregivers, and they don't want to have to put them in a nursing home either. But there's just not enough support out there to keep them living at home safely. So with PACE, under, you know, the Centers for Medicare and Medicaid Services, we can provide what would typically be covered under Medicare and Medicaid, including the medical component of care, as well as what would be covered under long-term care services, and then put those services not only at the center when they come into the center, but also in the home as much as possible.
How does a person, you know, first question, how does a person find out about your program, and then how do they go about enrolling?
Well, we've been doing a lot of educating over the past year or so. Most of the people that we're getting into the program right now are from senior housing, locally here in Long Branch and surrounding areas.
Public housing, many of them?
Public housing, sure. If they meet the criteria, if they want to enroll in the program, they would call us up or be referred to us by either doctors, case managers inside the hospitals, social workers inside the hospitals, social workers inside the day centers and so forth.
Mm-hmm.
They would call us up, and then we would follow up with an enrollment process, which means having an initial intake assessment by our enrollment specialist, and then each member of our team would, first of all, we go out and do a level of care to make sure that they do meet the medical criteria.
What does that mean, a level of care? Somebody goes and interviews them and looks at the medical records?
A nurse goes out. A nurse goes out to determine if they need assistance with activities of daily living. That's basically it. Could they be at the nursing home level of care?
Okay, the phrase you just used, the need of assistance in daily activities, what does that mean? It means they shouldn't be living alone, or they just need someone, they need help in being able to stay where they are?
They need help in to stay where they are. So maybe they need a little help with, you know, dressing or toileting or transferring, you know, things that we kind of take for granted that they need assistance with, but with the support of the services, that they can stay in the home with some of that help. You know, there's services out there now that, you know, somebody can hire somebody to be a home health aide that can help them with that.
That's very expensive.
It can be expensive, and then they stay in their home.
Right.
The other component of the PACE program is that we have the center that's located at Fort Monmouth in Oceanport, And the center has been fully redesigned. It offers day care activities as well as all of the professional disciplines that include physical therapy, occupational therapy, nutrition, social services, recreation activities. We have a clinic there, and
A medical clinic.
a medical clinic there where our physician, who is Dr. Indira Kanuka, she's our medical director, she becomes the primary care provider for an individual that enrolls, so that we're able to oversee their medical management as well as the other disciplines that may need to be involved in their plan of care.
So you were talking, Noel, about somebody goes out and interviews a prospective participant in the program, and they're going to make the evaluation that this is a person who would qualify for a nursing home or some, I'm assuming, or even a stepped-up level of care, but you can help. What happens next?
Well, they have to send that level of care to the Office of Community Options, which takes a look at that level of care, which is state-run, and they will tell us whether the person, whether they put their stamp of approval on that person to be part of the PACE program. When they bring that level of care back, we have an interdisciplinary team of 11 professionals who sit around our conference table every single morning, and we develop an individualized care plan for each and every individual that comes into the program.
So first the person is approved by somebody not associated with you, and then they're sent to you and approved, and you develop a medical care program for the person.
Basically, each of the disciplines has to do an assessment. So that's where the comprehensiveness is. So the physician, nursing, physical therapy, occupational therapy, nutrition, social work, they will all, after that level of care has been established, they will all do an assessment of the individual, hopefully with the caregiver or family members, and
Some of them
identify what the needs are going to be for that person.
The proposed participants, I imagine, come from, some of them probably have family members supervising, and some probably don't.
That's
Oh,
correct.
absolutely.
That's
and it's a
correct.
true partnership, too, because when we develop this care plan, it's a partnership between the caregiver, family members, and ourselves to make sure that the person is being taken care of on the weekends, or if they do need more help during the week, we need to develop a home health aid portion of our business.
So if
as
it
well.
were my family member, and I was the supervising individual, I'd be over at your place on occasion to meet with people there.
You could, absolutely. Especially from the initial enrollment process, we really want to include the family members because, as Noel mentioned, it's a partnership. What can we put in place? What is the family going to do in terms of that safety at home? But it can still alleviate a big part of the burden when you're able to bring somebody into the center, provide the transportation to bring them in 2-3 days a week if needed.
You can provide
We
transportation.
provide the transportation, yes. We have our vehicles and drivers that will go door to door. Basically, they go into the home to pick up a person. Some of these folks are in wheelchairs or using some sort of assistive devices. They help them get into the bus, and we provide the transportation to and from the center.
So you're picking them up essentially first thing
and
in
in certain
the morning.
instances, we're sending out a home health aide prior to the pickup to get the person ready, up, dressed, washed, and then help them onto the transport, which will take them
Everybody
to the day
needs a
center.
different level of care.
Exactly.
Right.
And
Now-
that's something that's decided by the interdisciplinary team.
Does everybody, if they come in first thing in the morning, do they all then stay the same amount of time until the bus is ready to leave, or it varies
Usually,
depending
yeah.
on?
Yeah.
And how long is the day?
They usually come in between 8:30 and 10:30 in the morning, and then leave between 3 and 4 in the afternoon. But that can be individualized as well. Some folks, we have an individual right now, she can't come in until 11 o'clock in the morning. So we, have to coordinate the transportation to be able to make the trips and, and meet those needs of the individuals. Some people can only stay for, for 4 hours, say, during the day.
What do they do during, is 100% of their day they're devoted to medical care, or are there other things
No,
going
they're put on a schedule, according to their care plans. So if they come Monday, Wednesday, Fridays, maybe Monday is their clinic day once a month. They can be seeing the physical therapist or the occupational therapist while they're there. Most likely they're involved in recreation therapy because socialization is a major part of our program. We want to make sure that we get all the individuals out of their homes as much as possible for two reasons. To give them the socialization, but to have the eyes on, because that's where we make a difference. Having everyone from the transportation all the way down to myself, Sue, anyone who's walking through, the center, gets to know the person on a daily basis. And we know exactly what a good day looks like and what a bad day looks like. And that in itself will allow us to get in front of, maybe something that, is brewing.
Now, the goal here, take care of you call them
Participants.
Why? Why is that the word,
Well,
as opposed to patients or clients? Or
they're not a patient because they're a person living at home. To the doctor, they're your patient, but
Right.
to the rest of the team, they're not the patient. They're a participant. We're developing a community of these participants that all have different kinds of needs, but all have needs, and can hopefully develop those plans that will that will address them. So they're people. So it is interesting, but yeah, that is the term, participant.
So, and they're involved in the planning process?
Yes.
Oh, absolutely.
Yes.
So they come in, Monday you were saying might be the clinic day, once a month. So they'll see a whatever kind of therapy they need. What do they do after that? Food?
Well, they'll have a light breakfast,
Right.
when they come in, and then, they'll be involved in recreation. So we have a recreation therapist who runs group activities, mind games, whatever, exercises. And at that time, maybe physical therapy. They have a scheduled visit to the physical therapist. Then we have a full gym with all the equipment right next door, right on premise.
Supervised more as
Supervised.
therapy as opposed to nobody's getting up and playing basketball or that kind of
Right,
activity.
exactly.
No.
But it's something to get them out,
It's
up and moving.
It's individualized for for them based on what activities they can do, but you really want to incorporate exercise into. And physical therapy and occupational therapy will work with the recreational therapist to do some of that. Not every individual needs one-on-one physical therapy, but we can incorporate the the concepts and the premise of physical therapy into general activities, whether it be walking, as simple something as simple as a walking club, to to more one-on-one type of activities. But again, that's individualized based on the plan of care. The other important thing with the center is, everybody is kind of on a different schedule. Yes, we provide the meals there. We also have full personal care areas there. You have individuals that are living at home that can't take a shower or bathe themselves. Some of it's supported with home care, but if that's really not feasible, we can incorporate on the days that they're going to be there that they can be showered. We have a hair washing station so that they can get their full personal care that could be incorporated into that plan. If there's a problem with laundry services, we deal with that. The all-inclusiveness is beyond the medical components. There's other aspects within their home that we may need to put in place, working with their family to address some of the safety issues. Are there grab bars that need to be put in? Is there modifications maybe within the home that we can look at?
Are you in the homes of 100% of the participants?
Yes.
Somebody goes into every home to make sure it's safe. And
Oh, yeah,
Yes.
there's a safety assessment that gets done initially.
Okay.
Yeah, that's
intake.
that's part of the requirement, and typically that's between the nurse and the occupational therapist. They'll go in and assess the safety at home, because if they can't stay safe at home, then they're really not going to be able to be appropriate for this type of a program.
All right, we're going to take a break and then we're going to come back for the second half.
Thank you.
Your seat cushion can be used to grant wishes.
Who said that? Hello?
Really can, you know.
You talking to me?
Sure am. Because the airline miles you earn and donate to Make-A-Wish can help send thousands of kids on their wish trips. So donate to Make-A-Wish today.
You really should, You really should.
And give wishes wings, because wishes work wonders.
All right, we're back for the second half of Community Connections. Now, it sounds like a very interesting and challenging line of work. How did you get into it?
Well, I started about 2.5 years ago. I had been working at Monmouth Medical Center.
A nurse for
Yes, I'm a
few
nurse by
years.
profession. I had been in a number of jobs, including administration, for a number of years.
Mostly here at Monmouth Medical?
Yes, and I was approached by the leadership of Acute Care Health System that they were planning on opening up a PACE program in Monmouth County. They had already done the feasibility study, and the demographics had supported the need in this area. And I really didn't know what it was. I wasn't familiar with it. So, did some research and took some time and decided to make the change at this point in my career to, take on this new challenge. It was brand new. The need is there for seniors in our community. Myself, working in the hospital, I saw what happened. Patients come into the emergency department, they get admitted to the hospital, they go to subacute rehab, they go home, they have visiting nurse services, the Medicare dollars run out, the next thing you know, they're back in the emergency department.
Because they can't quite take care of themselves.
They can't quite take care of themselves. And, they don't want to go into a nursing home. They'd like to stay at home and live at home for as long as possible, but they need support and community-based services that the system is fragmented. And the idea of a PACE program is that it's much more of a comprehensive package.
Now, your background is both in finance and social work.
Exactly. Yeah, I started years ago as an X-ray technician, then went into finance for 30 plus years. After I retired from Wall Street, I went back to school, Monmouth University, matter of fact, as an adult student. Earned my
How'd you like college as an adult?
I loved it as an adult student. I was one of the guys in the front row, like all the other adult students. But I thoroughly enjoyed it very much. And then after that, I just followed a geriatric track. I earned my master's degree in social work as well, and worked as a administrator in long-term care, subacute rehab. And
subacute rehab, you use that phrase too. That means they didn't come in and have major surgery, but they have health-related, they have issues.
Yeah, they're coming out of the hospital, and they need some kind of rehabilitation before they go home. And typically that's covered under Medicare.
But your days
private
can run
insurance.
out.
Yes.
Sure.
I mean, and I know just about everybody talks about how with an aging parent or somebody that they're the caregiver, it can be a little panicky.
Yes.
Oh, sure.
The days run out, and then you got to go home or long-term care, and mom or dad doesn't want to go to long-term care, and the children are fearful. Can I really take them home? Can they be home alone? What kind of other services can I get?
And it's probably much more, it's one thing if you have money and good health insurance coverage and kids who have the ability to put all this together, but if you don't have those resources, it's harder. And you had said, Sue, you had never heard of this program 2.5 years ago.
That's correct. And, I learned that it did exist in 4 other counties in New Jersey. There's one in Jersey City, in Camden, down in Vineland, and in Mercer County. And also there's 115 throughout the country of PACE programs. So it is a sanctioned program under Medicare and Medicaid services. And the way it works is the program is paid by Medicare for the federal health care component, and by Medicaid at the state level for somebody who is at that financial level that qualifies for Medicaid. And the PACE program then uses those dollars to pay for the services. So anybody that gets enrolled, they are no longer responsible for paying their doctor bills, paying co-pays, paying for their medications. We get paid that capitated rate, and then we are responsible for providing those services and paying for those services.
In theory, and you may not have seen it, you've only been open for a couple of months. People come into these programs, your participants.
We've seen amazing differences already.
Well, I would think that now you have somebody monitoring them daily, if not quite daily. Their health gets better and their health care costs go down. Is that one of the goals?
That's definitely one of the goals. And the way the health care costs go down is utilization. So the whole idea of having this full healthcare team that's under one umbrella, seeing these individuals, working with these individuals, improving their engagement, quality of life, and having that medical management can really help reduce utilization of resources.
Now, I know one of the things when my parents were sick, getting one person to sort of know what was going on with the various issues that they had in the various doctors. One person who could say, okay, you've got this doctor, and this doctor, but I'm in charge, and here's the decision I'm recommending.
We choreograph all of that. It's under one umbrella, and when the interdisciplinary team gets together and puts together that individualized care plan for each individual, their schedules for their doctor's appointments, if our doctor, Dr. Kanuka, who's our medical director, deems that she needs external tests or needs the participant to go to a pulmonologist, cardiologist, so forth, she'll send that person to one of the doctors in our network.
Not all those doctors are cardiologists. You don't have a pulmonary specialist at the place.
No, not at the place.
But you'll transport and
We're
take care of
contracted
it.
with all the specialists.
So if the life of the caregiver just got a lot easier.
Oh, absolutely. Just take away all those visits to doctors that they had to take off from work or use their vacation time and so forth. I mean, we're orchestrating all of that now. We're making the appointments. We're picking that person up, participant up from their home, taking them directly to the specialist, waiting with them, bringing them back home. And all those reports come back to our medical director.
Is that going to be one-on-one transportation, or is that a bus and there's other people being taken along?
Typically, if it's to a medical appointment, it's one.
Probably one. Yeah.
But being picked up and taken back to your home for the day center visits, there's multiple people on the buses.
So how big a staff do you have? It sounds...
Right now, 22.
So you have more staff than you have participants?
Participants, sure.
That's correct.
But that, I assume you're working on changing.
Yes. Well, the whole idea is obviously to grow the program and to...
Did you start with 0?
Yes.
You opened October 2015 with...
No, on October 1st, we had one participant.
One participant.
Okay.
And, because of the regulations under Medicare, we really were not allowed to advertise as we were putting the program together until we had our full agreement signed, because it's a contract that we have with Medicare and with the state for Medicaid. So those contracts had to be signed before we could even advertise.
Okay.
And really go forward with more education to the community. So we did enroll with one in October. We enrolled 6 in November, and we've enrolled 6 additional in December. That's where we're at this point.
In terms of what you projected before you opened, are you on pace for where you want to get to?
We're a little behind just because of the October start, but our goal is to really try to enroll at least 6 participants per month. Our target with the size of our center is 300 plus participants, so it's not like we're covering thousands of lives. In order to be able to really do the good job and do the right job, that's kind of the target number. But it could, we could relocate into another area of Monmouth County and expand that way down the road.
Now, you're geographically charged with a very specific zone.
That's correct.
And how big a zone? It's not all of Monmouth County.
No, it's not all of Monmouth County. We have about 45 or so zip codes in Monmouth County, including Long Branch and Western and Northern. Two of the cities that we don't have is Neptune and Asbury Park that were not assigned to us, and those are 2 areas that really have a great need for people that would meet this level.
Are they
of care
covered
criteria.
by another program, or nobody yet?
Another program has those zip codes at the time being, but they have to, the state has asked everyone to hand in their intentions with those zip codes. So we're hoping that at some point
process?
we get it back. We get
Well,
them.
we're not sure, but the program doesn't exist right now in that area to service those communities.
And we get phone calls from both those communities, and we're sorry to say that we had to turn them away.
Now, we've talked a little bit, say I have somebody in my family who I think, and they don't live in public housing. How do I go about finding you guys? What should I look for? Just wandering off the street and that'll work, or website, or?
Website
Yeah,
would be the
website,
ideal place.
Beacon of Life.
Beacon of Life. We have a website, www.beaconhss.com.
What's the HSS stand for?
Health and Social Service. That's our incorporated name. Beacon Health and Social Services was set up as a non-for-profit organization, of which we're doing business as Beacon of Life. But basically, you know, the website, and there's search engines there that people can find if they're looking for PACE or they're looking for help for their elders. You know, there's ways to find that site, but once you find, you know, a PACE program, Beacon of Life, there's information there. It's how to contact us. You know, we've done some advertising in, you know, some articles in some of the local papers. You know, hopefully, you know, talking to you and getting the word
We
out
have
there.
thousands of people watching this show.
But we've also been really, you know, going to the senior housing and, you know, educating the individuals that live there, that run those housing, because that's where a lot of these
I would
folks
think you'd
live.
have to have a close connection with the various housing authorities in
Yes,
Monmouth
yes.
County.
No,
We, you know, and they've been terrific because they worry about their people that
Yeah.
are living there, and they
Yeah,
want
they
them
do.
to stay living there. And most of them do live alone there, in many of, you know, that are in this situation.
I would think
Oh, yeah,
from,
we get
from-
you know, we do get numerous phone calls from the people who work, the managers in senior housing, and they become very, you know, close friends of ours because they do see hands-on those people in their buildings that need help.
and they can't, these aren't services they're going to
They
provide.
can't help, they
Right.
can't provide.
Right.
So they've been looking for services like ours. This it's life-changing for a lot of seniors in Monmouth County, what we're providing at the PACE Center.
Well, I think that's a great way to end the show. I appreciate both of you coming over, and I certainly learned something.
Thank you. Thank
Thank
you
you
so
very
much
much for
for
having
having
us.
us.
Appreciate it.
Good. Thank you.